By this point, you've viewed the course lecture videos on both the course project and on the week 3, which was entitled Assessing Physical Security. Now, to supplement the video lecture on that course project, I've worked with the instructional designers here in the College of Justice and Safety to develop an augmented reality model. Now, augmented reality was designed to produce and provide a view of a physical, real-world type environment whose elements are augmented by computer-generated sensory input. And to boil that down, the purpose of this model is to give you, the student, a better idea of what to look for when you're conducting a security site survey. For purposes of today's demonstration, this model is going to be the first floor and the grounds of a small community hospital. Remember, this is just an example. There's no one-size-fits-all approach to assessments at a critical infrastructure site. We're going to provide several points of consideration to contemplate when conducting your own assessment. Let's go ahead and get started. Now, as we've discussed in this course, there's 18 critical infrastructure sectors in the United States. One of those sectors is the healthcare and public health sector. This sector is going to account for approximately 15% of the gross national product, and more importantly, it plays a significant role in response and recovery across all the other sectors. The goal of this sector is to mount a timely and effective response to both routine and emergency situations as it strives to protect the critical workforce in this country from harm. Before even arriving on site at the hospital depicted in this model, remember that I'm going to conduct some background investigation with the hospital personnel, local law enforcement, and other data acquisition methods to determine the crime rate in the area, if there's any problems in the area with issues such as vandalism or anything in that manner. Lastly, I'm going to request from the hospital any standard operating procedures, especially if those items deal with safety and security related items. Now that we've conducted some of our background research, let's take a look in front of me here, and we're going to the facility, and this is our augmented reality model. Okay, let's start by looking at the outward perimeter. As you're going to see all around the facility on 3 of the sides, we're going to have a fence line of trees and shrubs. Basically, this is setting the perimeter for our facility. This, as we've talked about in previous chapters, could be defined as crime prevention through environmental design. What we're looking at is a way to offset the hospital's property from other properties that may flank on each side. So that's one of the parts. Given that it's a hospital, most hospitals don't have a requirement for fencing or other types of hardware, so this is not necessarily a concern of ours for this facility. Next, we're working our way in. As you can tell, on 2 sides of this facility, you're going to have parking lots. These parking lots have cars parked in them. They could be either staff, doctors of the facility, or they might be visitors to the facility. If you look closely, these parking lots also have security lighting in them. So as we've talked about in the lighting chapter, one of the things we're going to look for with security lighting is we're going to come back after dark, and we're going to bring our security light meter with us, and we're going to determine what the illuminance of that area is. We'll consult that in either lux or foot candles, whatever your preference may be, and determine if the lighting requirements for these parking lots are sufficient for this area. So that's another thing we're going to look at here before we even get into the building. Now, one of the other things we'll look at, we'll go here to the front of the building, and we'll see that where the ambulance is parked there, we've got a public road that runs right in front of this building. Okay, it's going to be one that provides easy access to the hospital there. So we want to take a look at how we're accessing this. The front of the building here has 2 entrances, as you can see right there. Those 2, one of them is the main entrance to the hospital, and the one right in front of the ambulance there is the emergency room. Now, we've talked in this class about the easiest way to design security is at the blueprint phase, but the reality is going to be that we may not always have that opportunity. So what we want to do is do the best we can with what we have in front of us. One of the things that's missing here that we need to take a look at is we need to have some barriers. And this will keep a car or other vehicle from coming in those front doors, whether on purpose or accidentally or either way. So something like a bollard or some other type of barrier on those front doors. The best way, if the hospital was going to do a redesign at some point, would be that they would reevaluate their entrance and maybe put the emergency room main doors on this side of the hospital, keeping it away from the main entrance of the hospital. Okay? So then we'll come back around. We want to look at the perimeter of this building. Now we're getting into the actual facility itself. What you're going to see here is that outside view again. Again, two doors. The one with the emergency obviously is marked the emergency room department. You're going to see the main set of doors. Now, it may be a little bit counterintuitive for a security professional to take a look at the locks on a hospital, because we assume that hospitals are open access and that they should be able to be accessed at all times. However, keep in mind that after hours we may lock the main entrance door seen right there, and we may divert folks to the emergency room doors. Also keep in mind, if there's a security threat inside that hospital, anywhere inside of this hospital, we may have to go into a security lockdown whereby we'll lock all the doors of this hospital. So we want to take a look at the locks and make sure that they are that they can secure this building appropriately. We also want to take a look at the doors. Remember, you can have a great effective lock, but if the doors are not effective, then the locks are worth nothing. Okay, so make sure that the assembly hinges and pieces such as that are not exposed, and that they can secure the facility and the people and the assets within. All right, let's move our way through the front door, and what we're going to see here is inside. Right there when we come in is going to be the Welcome Center, Information Center, waiting room area. Okay. And what we want to look at this is where an individual is going to sit, and they will inform people where to go, what room the patient's in, and so forth and so on. There will be a group of seats, as you can see, around that for folks to wait for people to come out of surgery, for them to wait for visiting hours, and other activities inside the hospital. You'll see a vending area right there next to the Welcome Center. This area can be used for different concessions and for hotel patrons to use while they're there. Now with the vending area, we won't have active people in there selling goods, but we will have machines. So if necessary, maybe a small surveillance camera can be installed to make sure the machines are not vandalized after hours, or anything doesn't happen like that to that area. On the other side of that concessions area, you're going to find a small gift shop. Very customary to a hospital. A gift shop provides things like flowers and balloons and other small gifts to take up to the patients to brighten their day. Obviously, we'll have a staff person working in that gift shop, and we're going to have a cash management piece to that. We want to make sure that that's secure in some type of lockable register, and make sure that policies and procedures have been put into place so that cash can be transferred to a safe at the end of the night. It also probably be a good idea to put some type of surveillance in there, at least to try to defend against shoplifting or other types of crimes that may occur. All right, we're going to move over here to this side of the building. Right here in this corner, you're going to see a desk, and that desk is the business center of the hospital. This is where you'll come to pay your bills. This is where they'll assess where you need to go in terms of outpatient surgeries. This is where the control of all financial matters will happen within the hospital. Without an effective billing and collections piece of the hospital cannot operate appropriately. So it's a very necessary piece. There are data security issues here. We have laws with the HIPAA laws and different healthcare privacy acts now that we have to be considerate of when dealing with patient information. So we have to make sure that computer has a security lockdown procedures on it, that has the effective software so that information cannot be accessed. We're going to move in now closer and look at the security office right there on the other side of that. You'll see a whole host of monitors inside of there. This is where a security guard could sit. This is where all the cameras inside the hospital are monitored or at least recorded. Quite likely, the security force in this small hospital will be somewhat limited. The security guard will probably not man this post at all times, so we want to make sure that there is adequate recording capabilities at this time. The two offices on each side of that security office are both business offices. This could be filing, this could be storage of records, this could be different parts and pieces of running the business of a hospital. Office security templates should be used here, the security checklist that we've talked about. They do the same with computer security to ensure that those are effective. Now, moving to the very middle, you'll see that yellowish box right there as we go. That signifies our elevator shaft. There are several ways to lock down an elevator shaft. In terms of looking at it like this, you're going to be able to see that there's two different elevator shafts. This comes into play a lot when we deal with floors such as labor and delivery or other floors where assets, we want to make sure that assets aren't taken away. For example, on the labor delivery floor, we might want to install some RFID technology, radio frequency identification, attach that to the hospital armbands to make sure that those newborn babies don't walk off without their parents in tow. Okay, now we're going to turn now to this back corner of the hospital, right back in here, and we're going to see a suite of different patient rooms. Now, these rooms may be used for outpatient surgery type rooms. They could be used for different procedures. They could even be used for patient rooms. What you're going to see is a door right there that comes in and makes sure that no one gets access to that area. It's not a public access area. So on that door, we'd be anticipating some type of access control system, whether that be a biometric or some type of card reader system of some type to make sure that folks don't get into that area if they don't belong. You're going to see a nurse's station or a check-in desk there as right there when you get inside that door. That will keep some folks from accessing that area, but you can't rely on a human manning a post at all times. You want to make sure that the effective access control systems are in place. Now, one of these rooms, as you rotate around, you're going to see a whole host of different pharmacy-type cabinets in there. If you look at the very top of the screen there. And what the purpose of this room is, will be some type of drug or pharmaceutical storage area. This obviously is a security risk to this hospital. The obtainment of drugs, either in a legal format or legally, and then selling them to others is a huge problem in the United States. We want to try to counteract that with the appropriate controls on that room. Obviously, surveillance cameras would be a good idea for that room. We'd also want to make sure the appropriate access controls are also inside that room. We also want to make sure as we go around the side, we can see there's no windows on this side. That's a good idea from a security concern, so that's one less security feature that we're going to have to install. We won't have to worry about window breaks or any volumetric type devices on those windows. We can just go ahead and concentrate on the interior door and have folks where they're accessing that. All right. The remainder of this time I want to spend on this other part of the hospital here in the back corner. What you're going to see is this is our emergency room. So I'm going to turn us around and I'm going to have us come in those front doors right here into the emergency department. What you're going to see when you come in right here in the corner is a kind of a welcome type desk. This would be where a receptionist or some type of entry would check you into the emergency room. Some waiting areas, as if you've visited a waiting room in any hospital, you'll know that there is going to be some waiting involved. So we'll have some of that. What you're going to see right across from it, right up here, is a triage area, a couple of different triage rooms. As you know, in an emergency room department, the ideal is you come in, you're checked in, and then a nurse or nurse practitioner of some type triages your situation to determine the severity of your need, whether they need to take you back right then or whether you can wait and let more severe patients take precedence over you. You're going to see a couple other treatment rooms. These could be suture rooms or other types of specialty rooms, maybe with different types of equipment, with EKG machines or other types of equipment. So the entire piece, we've got access controls placed on these rooms in a secure area to make sure that patient records are kept intact and that the different equipment is also kept intact. I'm going to take you to the back of the hospital now, this back corner. We've got a suite of 4 different patient actual working rooms where they can receive emergency treatment. This can range in severity from a community hospital where they're just trying to stabilize individuals to get them ready for processing to a larger hospital, or this could be a simple stitch or two or some different type of procedure that they're going to take care of. We want to try to maintain as much privacy in these rooms as possible while making sure that the safety and security of our hospital staff and visitors is maintained. Basically, we have a holistic approach here on this first floor of this hospital. As we come to a conclusion here, you might be thinking to yourself, now this doesn't look like the hospital that I go to. I want you to remember, as I stated at the beginning, there's no one size fits all. Every facility, every building is going to be a little bit different. When we get into assessing critical infrastructure and assessing security, there's no one size fits all approach to that. There are more questions we could have asked. There's other areas we could have looked at. The purpose of this augmented reality model is to give you ideas, to give you a cross-section of a critical infrastructure, to make you think about the ways you might approach a security survey. I hope you found this model informative, and I wish you the best of luck as you conduct your physical security survey.